بسم الله الرحمن الرحيم الحمد لله رب العالمين حمدا كثيرا طيبا مباركا فيه والصلاة والسلام على نبينا محمد وعلى آله وأصحابه ومن تبعهم بإحسان إلى يوم الدين وبعد. Okay, in this little brief video I just want to talk about the importance of doing the jet hijama treatment on a regular basis. Now what we have found from experience is that if somebody does the jet hijama treatment 3 times a week, they get a lot of relief and benefits from the treatment. Just doing it once a month is not enough for some patients. I repeat that, just doing it once a month is not good enough for some patients. You have to do it 3 times a week really to get some benefits for some patients. And this is again from experience. So if you're having problems with your ruqyah, you find that your ruqyah treatment is just not doing enough for you, because it's weak, and you have to understand, and the reason why it's weak is because our iman, in general, our iman is definitely not like the Sahaba, and a lot of us have a lot of sins. So our ruqyah is weak. If you remember the Sahaba, they would just read radiallahu anhum, they would read Fatiha 7 times and the person would get the cure. In our day and age, it's just not like that. So our ruqyah is weak. That's why you find many people getting treating themselves with ruqyah for a long time. I actually recently met a brother in the mosque, and who said, he's just lost, basically interest in doing the ruqyah and continuing to doing it. And the reason was because he basically hit a brick wall. He wasn't getting anywhere with the treatment. The ruqyah he was doing the ruqyah. He was using, he was doing all he needs to do with regards to the ruqyah, following the sunnah. However, it was not doing much for his spiritual disease, and the spiritual disease had not improved much. So I suggested to him that he does the jet hijama treatment 3 times a week. Now this brother has never really done the jet on himself, so inshallah ta'ala, hopefully that would help that brother, because from other patients I've spoken to and I've given this advice to, they have really benefited from doing the jet hijama treatment 3 times a week. And now when they do it, they're supposed to use maybe the smallest cup available, something like this. And where you would do it will be on your forearms and your lower legs. Anywhere on your forearms, anywhere on your lower legs. So for instance, maybe a person will do this forearm on a Monday, and you maybe do this part of the forearm on the Wednesday, and then on a Friday they might do on the other arm, and then they do it on their lower legs as well. You can do it on both lower legs as well. So they change in between the limbs. And when they do that, they shouldn't take too much blood out. And if they only take about maybe a tablespoon or 2 tablespoons of blood out every time they do it, it shouldn't really be a problem. However, if you're worried about how much blood you're taking out, then you should speak to a health professional regarding that. But from experience, taking 1 to 2 tablespoons generally for people, it's not a problem. You have to remember that when somebody does hijama once a month, now sometimes in some cases they're taking 200 mils of blood or 250 mils of blood in each session when they have on a monthly session. So if you just imagine that amount of blood divided over maybe 12 sessions, okay, because that's what you would do if you were doing the jet hijama treatment 3 times a week. You will do it, it'll be 12 sessions, If you divide that amount of blood, and then you shouldn't be more than maybe 15 or 20 mils, 15 to 20 mils of blood you're taking out. When you do that, you find that the patient really benefits from it. I mean, they have to do it about 12 times. When they do that, they will come back to me and they've said, yeah, this really has helped me. So it just proves the importance of doing this jet hijama treatment 3 times a week. You see, I mean, is it possible to do it more than that? I think it is. It might be even possible to do it more than that. But again, what's stopping us doing it every single day is the amount of blood you take out. If you're only taking a small amount of blood out, then it might be possible. But before you do something like that, doing it 3 times a week, 3 times a week or even every day, you need to speak to a health professional. I have had one case where somebody has done it maybe 7 times in a week, maybe every single day. just to give himself some relief, because he had a lot of waswas. That particular patient, when he got back to me, said, he really benefited from it. You see, doing it every day, for using smallest amount, because he's only taking a small amount of blood out. But when he did that, he got a lot of relief from the waswas, because that's what the most patients are complaining about, is the waswas, and those effects of that jinn. And when they do that, when they do it several times, the jet hijama treatment, they get a lot of relief. So if you're one of those patients who are having a lot of problems with their ruqyah and you're not getting much relief, then my suggestion would be, and I strongly recommend that you try and do more jet hijama treatment, inshallah ta'ala.